provision of health services and access to quality health facilities play a crucial role in ensuring good health for all. Access to highest attainable standards of healthcare in facilities, irrespective of race, religion, economic and social condition, is a fundamental need of people, specifically from the underserved sections of the society. This becomes all the more critical for a mother and her newborn baby, where the health facilities, being the first point of contact, need to provide an environment which caters quality service. Various government flagship programs have prioritized reduction in maternal and neonatal mortality, along with improvement in quality of health services and facilities being delivered. These being sensitive indicators of a country's socio-economic development. Considering that health facilities have an environment prone to high prevalence of infectious disease agents, safe water sanitation and correct hygiene practices are basic components of healthcare service delivery system. Caregivers and receivers face risk of infection if the WASH, known as water sanitation hygiene component in health facilities, is inadequate.
দেখুন আসলে হাসপাতালে রোগীরা যায় তাদের সম্পূর্ণ আরোগ্য লাভের জন্য, বাট পৃথিবীব্যাপী স্টাডিতে দেখা গেছে উন্নয়নশীল দেশসমূহে যখনই তারা হসপিটালে চাইল্ড ডেথ যেগুলো হয়, চাইল্ড মোর্টালিটি এবং মর্বিডিটি যেগুলো হয়, তার মধ্যে বেশিরভাগ হয় উইদিন হসপিটাল ইনফেকশনের কারণে। প্রোগ্রামটা লঞ্চ করলে হসপিটালে যে মর্টালিটি অ্যান্ড মর্বিডিটি এইটা ড্রামাটিক্যালি কমবে, হসপিটালে যে ইনফেকশন হয় এগুলো কমবে। থার্ড হচ্ছে হসপিটালের উইদিন হসপিটাল যে ওয়াস্ট ম্যানেজমেন্ট সিস্টেম এটা অনেক ইমপ্রুভ করবে। ফলে এখানে হেলথ যেমন ইম্প্যাক্ট আছে তেমনি ইকোনমিক ইম্প্যাক্টও আছে।
রাজ্য সরকার এবং সুশ্রী এবং ইউনিসেফের যে যৌথ উদ্যোগে আমাদের প্রত্যেকটা ফ্যাসিলিটিতে এর একটা সুফল পাওয়া গেছে। এখন হাসপাতালগুলো আগে যেটা একটা কনসেপ্টই ছিল যে সরকারি হাসপাতাল মানেই মানুষ নাকে কাপড় দিয়ে ঢুকতো এবং এখানে চতুর্দিকে নোংরা এবং বিভিন্ন আবর্জনা থাকতো, জলের কোয়ালিটি ঠিক ছিল না। সেইগুলো এই প্রোগ্রাম আসার পর থেকে স্টাফ থেকে আরম্ভ করে সকলকে সেন্সিটাইজ করা হয়েছে, তাদের ক্যাপাসিটি বিল্ডিং হয়েছে। ফলে দে আর নাও ওয়েল অ্যাওয়্যার হাসপাতালকে পরিষ্কার রাখতে হবে।
আমাদের উদ্দেশ্য হচ্ছে মায়ের মৃত্যু, নবজাতকের মৃত্যু, শিশুর মৃত্যু কমানো। সেটার জন্যে কিছু কিছু যে ইন্টারভেনশনস যেগুলো আছে, যার মধ্যে ওয়াশ ইন হেলথ, ওয়াটার স্যানিটেশন হাইজিন ইন হেলথ ফেসিলিটিস খুব ইম্পর্টেন্ট। কেন ইম্পর্টেন্ট? কারণ আমরা এখন জানি যে বেশিরভাগ প্রসব হচ্ছে হাসপাতালে। সুতরাং অনেক মা তারা আসছেন হাসপাতালে এবং তাদের যদি প্রসবটা সেখানে হয় তাহলে এটাই এক্সপেক্টেড যে তাদের নিজেদের এবং তাদের যে নবজাতক তাদের কোনো রকম সংক্রমণ হবে না। ইনফেকশন কন্ট্রোল করার জন্যে কিন্তু ওয়াশ ইন হেলথ ফেসিলিটিস খুব ইম্পর্টেন্ট। সুতরাং এটার মধ্যে দুটো দিক আছে, একটা হচ্ছে ইনফেকশন কমানো, একটা হচ্ছে আমরা যেটাকে ইংরেজিতে ক্লায়েন্ট স্যাটিসফ্যাকশন বলতে চাই।
আমি এখানে এই জন্য ভর্তি হতে এসেছি, এখানে সব কিছু ঠিকমতো পরিষ্কার করা হয়, যেমন লেবার রুম, বাথরুম এবং বেড।
আমার আগের 2.5 বছরের বাচ্চা আছে, এখানে খুব সুন্দর পরিষ্কার পরিচ্ছন্নতা। তাই আগে সিজার হয়েছি, আমি ভাবলাম এখানে খুব পরিষ্কার পরিচ্ছন্ন, আমি এখানে দ্বিতীয়বার ভর্তি হই।
Inadequate wash infrastructure or facilities and practices can contribute to what is known as hospital-acquired infections. Healthcare-associated infections affect hundreds of millions of patients every year globally, with 15% of patients estimated to develop one or more infections during a hospital stay. Thus, a robust wash package in health facilities for maintaining good health and averting hospital-acquired infection of the clientele they serve is crucial.
আমাদের টোটালি এটা 5টা অ্যাসপেক্টসের উপরে টোটালটা নির্ভর করে। ফার্স্টটা হচ্ছে হ্যান্ড হাইজিন, নেক্সট ওয়ানটা হচ্ছে পার্সোনাল প্রোটেক্টিভ ইকুইপমেন্টস, থার্ডটা হচ্ছে প্রিপারেশন অফ ক্লোরিন সলিউশন, অ্যান্ড ফোর্থ ওয়ান হচ্ছে ইনজেকশন সেফটি। এর মধ্যে আরেকটা হচ্ছে বায়োমেডিক্যাল ওয়েস্ট ম্যানেজমেন্ট। এই টোটাল 5টার উপরে কভার করে এই টোটাল প্রিভেনশন অফ ইনফেকশনটা মেনটেন করা হয়।
Adequate wash in terms of infrastructure and practices is important at all points of care, where the critical areas such as labor room, operation theatre, emergency, wards, outdoor patient department, as well as in support services such as in laundry and kitchen, so as to prevent infection among the caregivers. There are various guidelines and norms defining the standard wash practices in health facilities, including WHO and Government of India guidelines. As per the Government of West Bengal's Shusri program, adequate wash in health facilities include availability of safe source of water for potable and non-potable use, which are functional, adequate, accessible, and of desired quality at all key locations. Sanitation includes easily accessible and user-friendly toilet facilities, 24/7 availability of water and hand-washing stations. The sanitation facility should be gender segregated, ensure privacy, provide facilities for menstrual hygiene management, well maintained, and have a safe disposal system of human excreta and grey wastewater. Biomedical waste management, including on-site segregation, safe collection, safe disposal, and management. Appropriate infection control measures like decontamination and disinfection of instruments and cleanliness of all critical areas, including the operation theatre and the labor room. Hygiene promotion focusing on availability of functional wash basins, soaps, 24/7 water supply, and hand wash practices. Support services like kitchen and laundry as per standard norms. Achieving and maintaining all the wash components in health facilities is crucial for a number of health aims, including those linked to quality universal coverage, infection prevention and control, patient safety, and child and maternal health. Wash is especially critical during child delivery in labor rooms. Wash in health facilities also extends beyond health impacts to issues of dignity and respect, staff morale, performance, and safety. A health facility should ensure that water is available of desired quality, adequate quantity, accessible, functional, and well maintained for use by staff, caregivers, and patients at all times. Largely, a health facility has two major sources of water supply: piped water supply from PHE and groundwater supply from borewell. In both cases, the supplied water is pumped to the overhead tanks for its multiple uses. The water storage should be sufficient to meet the needs of facilities for at least 2 days. The health facility must ensure that potable water facility and non-potable water must be available with adequate pressure at all points of care, whether OPD, wards, labor room, operation theatre, emergency, staff room, kitchen, laundry areas, and outside the hospital building. In the entire distribution network of water from the source of storage to the end user, there are critical points where there are chances of water getting contaminated. Hence, regular monitoring of the distribution pipes is essential to ensure prevention of water leakages and to prevent the water from being contaminated. In addition to adequacy of quantity of water, water quality is also an important attribute to consider in health facilities. As a part of regular water quality monitoring standard safety measure, every health facility must conduct water quality monitoring at regular intervals, such as bacteriological water testing twice a year and physicochemical water testing once a year. This is to ensure that the water used for all activities inside the hospital is clean and safe. To test the quality of water, there are certain simple procedures for water sample collection that need to be adhered to, such as before collecting samples for water testing, the person should wash hands, wear apron and sterile gloves. To collect the water from the tap or hand pump, a spirit lamp can be used to sterilize the mouth of the water source. For bacteriological tests, it has to be ensured that the water is collected in a sterile container. Along with the water quality analysis, it is equally important to ensure that the sanitary surveillance is carried out to assess the risk of contamination of drinking water at source and end use. Based on the survey findings, necessary actions should be initiated. The health facilities are required to maintain the record of water quality testing. The health facility must ensure that the water should be free of fecal contamination. National water quality standards should be followed. Water storage tanks and reservoirs should be well maintained and should have no leaks and cracks. The tank should have a tight lid. It should be cleaned every 3 months with chlorine solution, and cleaning record should be maintained. The health facilities may have water purification filters at point of use of drinking water. The filters, whenever installed, should be maintained as per the protocol. The various steps for cleaning and disinfection of water storage tanks should be as follows. Empty the tank. Scrub the interior walls to remove dirt and grime. Pressure wash the interior walls. Rinse out the water. Mix a solution of household bleach and water. Pour the bleaching solution inside the tank. Scrub the interior walls of the tank with this solution and leave it for 2 hours. Pressure wash with clean water. After 2 hours, thoroughly rinse the tank and refill with potable water. Care should be taken not to have any sanitary structures like soak pits or septic tanks near a water supply network. They should be at least 30 feet away. Surroundings of the drinking water facility must be clean. There shouldn't be any stagnant water or broken platforms, and drinking water points should be functional and well maintained in all locations. If all the above steps are followed, the probability of water getting contaminated reduces substantially. We should also make sure to have appropriate signage used near the drinking water facilities for proper handling and reducing wastage of water. Appropriate signage includes: do not leave the tap open. Do not keep the drinking water surrounding unclean. Do not throw waste into the water cooler or water stations. Do not wash hands or face in the drinking water station. Sanitation is an important health indicator. Improved sanitation has significant impact not only on health but also on social and economic development. In a health facility, the surroundings are frequently contaminated due to pathogens. Therefore, it should have proper sanitation facilities. Health facilities should focus on the following aspects of sanitation. The health facility should provide adequate, functional and clean toilet facilities in all the functional units that protect public health and environment. It should provide bathing areas, management of feces and urine. The health facility should provide safe collection, storage, treatment and disposal of human excreta. Proper drainage and disposal of stormwater and wastewater must also be ensured. To maintain sanitation standards, health facilities should ensure that the toilets and the urinals are available at all times, functional, accessible, separate for patients and staff, separate for female and male, and provide menstrual hygiene facility. In some areas, such as toilets inside labor rooms, the toilet facility should be as per the protocol, which prescribe Western-style toilets, wash basins, 24/7 running water, adequate ventilation and privacy. There shouldn't be any leakage, choked toilets or stagnant water in the bathrooms. Dustbins should be kept to dispose sanitary waste. There should be latches inside each toilet which can be locked from inside to ensure privacy. The toilets must have sufficient light, be adequately lit for use at night and is well ventilated. The health facility should ensure that the toilets are cleaned frequently, at least thrice a day or as needed. The health facility should maintain a housekeeping record which should be hung on the wall of the washroom so that it can be monitored easily. The health facility should ensure a good stock of supplies to permit effective cleaning. Proper signage with instructions must be used in the toilets to educate the users. This includes how to use toilets, disposal of waste into bins, use of wash basins to wash hands, the cleaning staff should put on all the personal protective equipment. This includes cap and mask, apron, utility gloves, and the gumboots. For cleaning of corridors, wards, keep in mind that first the corners have to be cleaned. Then start from one side of the corridor and cover the rest. In wards, make sure that first the corners are mopped in a unidirectional way, followed by the areas under the bed. Then the middle area between the beds is mopped properly following the S-curve method. Toilets and bathrooms are not the only places which need to be kept clean and hygienic. Cleaning the walls, ceilings and windows is also indispensable. The furniture and cot casters should be cleaned with a clean duster using the 0.5% chlorine solution prepared in a plastic tray directly or with a spray bottle. Door stoppers and door handles also accumulate dust and dirt. These, along with the latches, must be cleaned with 0.5% chlorine solution. Tabletops in labor rooms, operation theatre, emergency ward should be cleaned thoroughly with 1% chlorine solution. Cleaning personnel should put on PPE before starting the cleaning process. glasses, cap and mask, apron, utility gloves, gumboots. Bring the blood spill management kit and cover the area with blotting paper or newspaper. Blood should be covered by 1% chlorine solution and the area should be left for 30 minutes. Once the fluid is soaked by the blotting paper, dispose it off in the yellow bucket after picking it up in a plastic scoop. Then mop the area with 0.5% chlorine solution. In health facility, the mopping is done either by 2 or 3 bucket systems. The 3 bucket system has 1 bucket each to hold the disinfectant, 0.5% chlorine solution. Hold water to rinse the contamination of the mop head and collect the waste solution under the wringer. Dip the mop head in 0.5% chlorine solution, wring it and mop now. After one complete S movement, dip it in water to take out the dirt. Wring it. Dip it again in 0.5% chlorine solution, wring it and now mop again. After mopping, rinse the mop in 0.5% chlorine solution. Wash the mop in the dirty utility room and put it in the stand under the sun with the mop head upward and tilted and not straight. And keep all the equipment and tools in the dirty utility room and not inside the toilet. Leave the buckets to drain. The materials needed for cleaning the toilet is as follows: cleaning solution, brush, mop, bucket, mug. The cleaning staff should remember that they should always move from the cleanest area to the dirtiest. There should be separate cleaning equipment for each location. They should follow the proper procedure for cleaning the toilets. They should switch on the lights, put the cleaning or cautionary signboard, empty the waste bins, apply 1% chlorine solution in the toilet pans, wash basins, walls and floors. Allow sufficient contact time. Then, first clean the mirrors and the wash basins. Then the bathrooms. After that, clean the toilets, the dirtiest area in the end. The cleaner should also keep in mind that the sweeping movement should be S-shaped. The staff should note that cleaning the floor must begin from inside to outside, and in the end, all corners and grooves must be cleaned. There are certain precautionary measures one should keep in mind while cleaning and disinfecting. Use methods that are least inconvenient to patients. Make sure that while cleaning, areas do not become accident-prone. If required, put up cautionary sign. Check the final appearance and report the effect to the nodal housekeeping person. Degown carefully. If it is stained with body fluids, then dip it in 0.5% chlorine solution for 30 minutes. Wash it in detergent and let them dry. Remove the cap and mask. If disposable, throw it in yellow bin. Remove the utility gloves and boots. Wash and let them dry in dirty utility room. Wash hands following the 6 steps. menstrual hygiene management requirements are an important component of services that a health facility provides. It is important that mothers after delivery are counselled on menstrual hygiene. This includes use of sanitary napkins, proper hygiene maintenance, safe disposal of sanitary napkins after use, and hand wash. This experience during their hospital stay encourages many to continue these hygiene practices even after they return home.
তারা যখন বাড়িতে যাচ্ছে তাদের তখন নর্মালি একটা ডিসচার্জ হয়, তাদের একটা ব্লিডিং হবেই, সুতরাং তাদের তখন কিন্তু তাদের স্যানিটারি ন্যাপকিন ব্যবহার করতে হবেই। গ্রামের অনেক সময় হয় যে পুকুরে চান করে, সুতরাং সেটা দেখতে হবে যে ফিরে গিয়ে যেন তারা পুকুরে চান না করে, অন্তত পোস্টপার্টাম পিরিয়ড 42 দিন তো করবেই না। এছাড়া স্যানিটারি ন্যাপকিন ইউজ করবে, নোংরা কাপড় ইউজ করবে না, আগে যেটা করা হতো।
Biomedical waste management consists of 4 steps: on-site proper segregation, collection, disposal, and management. Segregation. In white puncture-proof container, dispose of scalpels, blades, needles, syringes, including sharp metals. In blue bucket, dispose of broken glassware or metallic body implant. In red bucket, dispose of contaminated waste like plastic bag, bottle, pipes or container. In yellow bucket, dispose of human anatomical waste, soiled waste, expired medicines, chemical waste, body fluid and clinical waste. In black bucket, dispose of general waste. These buckets have to be kept in appropriate location in each place. For proper collection, before collecting the waste, staff should put on personal protective equipment. The waste should be collected in a trolley, should be lifted from the bin by the personnel, and it should not be dragged. Waste should be collected 3 times a day or as and when the bucket is 2/3 full. Then tie the bags securely and put them inside the trolley. After removing the waste bags, replace them with a new one. Disposal. There should be a dedicated storage for each yellow, red, blue biomedical waste. After keeping the waste bags in the respective storage areas, wash hands in the wash basins attached to the common collection site. Management. The waste management in many hospitals is handed over to the external agency which collects the waste from the hospital and then processes it as per the proper protocol.
কোয়ালিটি ইমপ্রুভমেন্ট কোনো জায়গায় যদি কিছু করতে হয় তাহলে কিন্তু কিছু স্ট্যান্ডার্ড গাইডলাইন্স থাকতে হয়, এবং সেই স্ট্যান্ডার্ড গাইডলাইন্সগুলো যদি মানা হয় ঠিকভাবে তাহলেই কাজটা হয়। যেমন বায়োমেডিক্যাল ওয়েস্ট ম্যানেজমেন্ট, এবং হাসপাতালে এটা একটা খুব ইম্পর্টেন্ট একটা সাপোর্ট সার্ভিসের মধ্যে ধরা হয়। যেখানে ওয়েস্ট জেনারেট হচ্ছে, যেখানে তৈরি হচ্ছে ওয়েস্টটা, সেখানেই সেগ্রিগেশন করতে হবে। একটা তো হচ্ছে যাতে কমিউনিটিতে এবং বাইরে এনভায়রনমেন্টে এই জিনিসগুলো না ছড়ায়। আরও একটা খুব ইম্পর্টেন্ট ব্যাপার, সেটা হচ্ছে যারা হেলথ কেয়ার প্রোভাইডার্স, যারা মানে হাসপাতালে যারা স্টাফ, তাদের নিজেদের প্রোটেকশনের জন্যও কিন্তু এটা খুব ইম্পর্টেন্ট।
The black container comprising of general solid waste is handed over to municipalities in case of bigger hospitals, while in primary and block level health facilities, the general waste are to be dumped in a closed pit within the premises of the facility. Decontamination plays an important part in controlling infection in hospitals. It prevents the spread of microorganisms and other contaminants that may threaten the health of human beings or damage the environment. Decontamination is the process of making an object or area safe by removing contaminants such as microorganisms and hazardous materials, including chemicals and infectious substances. Decontamination process includes 3 steps: disinfection, cleaning, and sterilization. Decontamination of all used items should be done in their respective units like labor rooms, operation theatre, etc. Disinfection or decontamination is done using either 1% of sodium hypochlorite solution, that is the raw supply, or by diluting it to 0.5% chlorine solution as per the necessary requirement. 1% sodium hypochlorite solution is used as disinfectant in case of blood spill or blood-stained items and in toilets. (0.5% chlorine solution can be prepared by mixing equal amount of 1% liquid hypochlorite solution and water. The container containing the freshly prepared chlorine solution must be immediately covered to prevent the loss of chlorine gas. Freshly prepared chlorine solution remains active for 6 to 8 hours after the constitution if kept covered. If the solution becomes turbid, immediately discard and prepare a fresh one. Chlorine solution is effective against a wide variety of microorganisms such as viruses, fungi, bacteria, and spores. Immediately after use, the instruments should be soaked in 0.5% chlorine solution for 10 minutes. After soaking, rinse the instruments and clean them in a container of water. Scrub the instruments using brush and detergent solution to remove the visible dirt and remnants including bloodstains. Rinse them thoroughly in another bucket of fresh water to remove all the detergent and then air dry and sterilize. Instruments that need sterilization have to be sent to the autoclave unit. Signal lock must be used while sending the items for autoclave. In each of the drum or tray, 3 signal locks must be used. One at the bottom of the items placed, one on top of the items, and the last one outside the tray or drum to indicate complete sterilization. Place the items in autoclave loosely, then close the lid. This allows adequate permeation of steam inside the trays and drums. The wrapped items have to be kept for 30 minutes and unwrapped for 20 minutes at a temperature of 121 degrees centigrade and pressure of 15 pounds per square inch. Allow the autoclave to cool for 30 minutes before opening it. A detailed record with date and time has to be maintained for every instrument that is sterilized. Before entering the critical area, the staff should leave their shoes outside and wear clean slippers. After wearing the slippers, the staff should wash their hands following the 6 steps of hand washing. Then they should wear the rest of the PPE. Cap should be worn in such a way that no loose hair is outside and it entirely covers the head and the ears. The mask should be worn over the nose and mouth, and the part that is on the nose should be pressed so that it covers the nose properly. The apron should be worn in such a way so that it does not get soiled. The sterilized gown should not get soiled while wearing it. Surgical gloves should fit snugly over the wrists and hands. While wearing the gloves, make sure that it is pulled over the ends of the sleeves of the gown. Now the staff is ready to enter the operation theatre. Staff should remove the gloves in 0.5% chlorine solution. Wash off the blood and leave the gloves in the container. After it is left for 20 minutes, it can be disposed of in the red dustbin after tearing it. Then the gown should be removed. If the gown has got soiled with blood or body fluids, soak it in 0.5% chlorine solution. Rinse with clean water. Wash with soap and water. Hang to dry. The mask and the cap can be taken off and put in the yellow container. 6 steps of hand washing. Wash hands following the 6 steps of hand washing. If the gown has to be sterilized, it should be sent to the autoclave unit. Personnel working in the receiving and sorting area of laundry are required to wear cap and mask, apron, utility gloves and gumboots. After removing the used linen, clean the bed and the mattress with 0.5% chlorine solution. Then put a clean linen. All linen after use will be collected from all locations and segregated into potentially infected and not potentially infected in the dirty utility room. The cleaning staff should keep their hands away from their mouth and eyes. No eating and drinking is allowed in this area. The soiled linen is tied into bundles and an entry made into the register. The infected linen is accounted and handed over separately. The former will include all linen which has been soiled with body fluids and will be decontaminated in 0.5% chlorine solution for maximum 20 minutes before washing it in clean water. And then should be handed over for washing with detergent to remove the chlorine solution. The staff should thoroughly wash their hands after leaving the sorting area. The linen is washed, dried and ironed by the laundry staff. The linen is returned to the healthcare facility. Clean linen should be stored in a dry place on racks or in the clean utility area where it is properly taken over and a record made of the same. The kitchen staff should follow the 6 steps of hand washing and wear PPE before starting the cooking process as well as while serving food. While serving, they should wear gloves. The food should be carried in a covered trolley, and after serving, the containers carrying the food should be covered immediately. The PPE includes cap, mask, apron, gloves while serving. Adopting hand wash behavior is pivotal in healthcare facilities. Hand hygiene is the best way to prevent the spread of germs in the healthcare setting and community. It protects the staff, patients and visitors from a range of healthcare acquired infections. It can be used in healthcare settings to demonstrate to the community good hygiene behavior. Hand washing stations should be accessible, functional, clean, well maintained with liquid soap kept on the side. Drainage for the water should be proper with no leaks. A blower can be kept as optional for drying of hands after hand wash. There should be elbow-fitted taps in labor rooms, operation theatre and emergency wash basins. Hand hygiene promotion material should be clearly visible and understandable at key places. Caregivers and patients should be counselled on hand washing with liquid soap at critical times. Caregivers and patients must wash hands before eating food, before handling the child, after using toilet, after cleaning child's bottom, after disposal of child feces, after handling any waste, after blowing nose or coughing. Staff before putting on personal protective equipment, preparing food, eating. After taking off personal protective equipment, cleaning, handling waste, using the toilet or changing a child's diaper, blowing your nose or coughing. The next set of instructions should be on the technique of hand wash following the 6 steps.
এখানে আমাকে সিস্টার দিদিরা প্রথম কথা বাচ্চাকে কিভাবে পরিষ্কার রাখতে হয় এবং নিজেকে পরিষ্কার করতে হয় হ্যান্ড ওয়াশ দিয়ে সব কিছু বুঝিয়ে শিখিয়েছেন। তাতে আমার বাচ্চার এবং আমার দুজনেরই মানে ভালো হচ্ছে।
এখানে এসে আমি যেটা শিখলাম যে কোনো কিছু বাইরে কাজ করে আসলে কিছু করে আসলে আগে হ্যান্ড ওয়াশ দিয়ে হাতটা ধুয়ে পরিষ্কার করে তারপর বাচ্চাকে ধরতে হবে।
এই হসপিটালটা খুবই ভালো, খুব পরিষ্কার, বাথরুম জল সবই খুব পরিষ্কার, বেড খুবই ভালো, দিদিরাও খুব ভালো, খাবার দাবারও খুব ভালো এখানে, তার জন্য আমরা ডেলিভারি এখানে করাতে এসেছি।
সুশ্রী ব্যাপারে হসপিটালগুলোতে কীভাবে উন্নতি হয়েছে আর কি যদি দেখতে চান, তাহলে আপনাকে আজ থেকে 4-5 বছর আগে একটু পিছিয়ে যেতে হবে। তখন আমাদের সরকারি যে স্বাস্থ্য ব্যবস্থা ছিল তার যদি একটা ইন্ডিকেটর নিয়ে আমরা আলোচনা করি, যে ইনস্টিটিউশন ডেলিভারি, এটা ছিল 70-এর আশেপাশে, মানে 70%। তারপর থেকে যখন থেকে আমরা সুশ্রী ইমপ্লিমেন্ট করলাম আমাদের হসপিটালগুলোতে, তখন কিন্তু তার একটা ইমিডিয়েট যে অ্যাকসেপ্টেন্স বাই মানে পিপুল, সেটা কিন্তু আমরা দেখতে পেলাম। এবং সেটা মূলত মানুষজনকে আকর্ষণ করলো যে হসপিটালগুলো পরিবেশ সম্পূর্ণ চেঞ্জ হয়ে গেছে, এবং আমাদের ইনস্টিটিউশন ডেলিভারি সেটা এখন দাঁড়িয়েছে প্রায় 97%।
If we maintain good quality of wash practices in healthcare facilities, it will result in infection control in hospitals and healthcare centers, resulting in better environment for patients as well as for healthcare providers. Prioritizing wash indicators in health facilities, both by the caregivers and receivers, will play an important role in reducing healthcare-acquired infection and contribute towards reducing maternal and neonatal mortality.